and welcome to all of our Gold viewers who are here with us today. Welcome to Gold Learning and Gold Midwifery. My name is Kristen Schwartz, a licensed midwife and one of the MCs here at Gold. And I have a special guest with me here, Professor Claire Meek. Welcome, Claire.
Thank you. Hello.
Lovely to have you here today. You are, of course, part of our Gold Midwifery Online Conference here as a presenter. So tell us a little bit about yourself. Where in the world are you, first of all?
Thank you. So I'm a professor at the University of Leicester, which is right in the middle of England. So I'm looking forward to meeting the attendees from all over the world.
Oh, wonderful. So yes, Claire, you are a professor, of course, heavily involved in research. So tell us a little about your work, what you're doing, and about, what you're working on now.
Thank you. So I'm really interested in understanding the causes and consequences of diabetes in pregnancy. I tend to focus a lot on gestational diabetes, the most common form of diabetes in pregnancy, but I'm also running projects in type 2 diabetes and type 1 diabetes in pregnancy. Thank you.
Wonderful. Thanks. It's such an important work. And it feels like, we've known, of course, about gestational diabetes for a while, for a long, long time now. It affects a lot of pregnant persons all around the world. And still it feels to me that we still need to learn more, right? And you're doing research in that. And there is still no international kind of consensus. I feel like, we're all doing our own thing. It would be lovely to have, a worldwide kind of standard for it. Tell us a little bit about that. Do you see that as well? Or
Absolutely. So even within the United States, there's 2 or 3 different approaches, certainly 2 main approaches to diagnosing gestational diabetes. And throughout the rest of the world, a whole range of other approaches as well. And it's not just diagnosis, it's how we screen women. So who we test. So one aspect is universal testing. Should we be screening all pregnant women, or should we be screening only some pregnant women due to having risk factors or being of high risk ethnicity? So there's a whole range of different controversial topics within gestational diabetes. And I agree with you. I think it's a huge barrier really to improving care, this lack of standardization internationally.
Very, very interesting. And that's why the work you do is so important, and we're really grateful for that as well. Also, another aspect is access to care, right? I mean, talk a little bit about that. It's obviously there's a lot of barriers to access to care as well. Please report on that.
Yes, absolutely. So even I think we've looked quite a bit actually at our testing process within the UK. So first of all, there's the oral glucose tolerance test and so forth. And actually, we find that it's not very accessible for women if they have other caring responsibilities, if perhaps they come from more socially disadvantaged groups, if perhaps actually they don't speak English as a first language. All of these things can be barriers to women accessing the testing. And of course, if you're not tested, you're not going to be diagnosed, and that's therefore another major concern. I think at an international level, there's also a real need for a bit more consistency between what we recommend in urban areas and in rural areas. I know that there's been huge challenges in some countries trying to make sure that in very rural areas, women have access to some form of testing.
Yeah, absolutely. You brought up some very, very important points there. Access to testing, access to care, especially in rural areas where people have to rely on transportation. It's, of course, also a cost
Very hard.
issue. It's not always covered in wherever you are in the world, right? So there is a lot of improvement to be done still.
Absolutely. I think
Yeah.
it's worth saying also there's still a stigma about gestational diabetes, and that's another barrier both to testing, I think, and also to improving care. And so we need, I think, as the healthcare community to work hard to overcome some of those barriers so that women feel less judged.
Yes. Yes. You brought up this very good point, important point about stigma. Yes, there still is to this day, So as healthcare professionals, not only do we have to, of course, provide access to tests and the proper care for it, but also education, right? I mean, there is still to be done in that area as well.
Absolutely, a lot that needs to be done. And some of the health messaging, I think, around the importance, for example, of weight control has largely been positive, but it has made it harder, I think, for women who sit in higher BMI categories
Mhm.
to feel accepted within healthcare circles. And I think that's a major challenge for many of us working in healthcare to understand how those barriers can be effectively broken down.
Mm. What I love about the presentation you will be holding here at Gold for the Gold Midwifery Conference is you're not just talking about statistics and testing. You also tell us, you will talk to us also about what we can do, right? And what we can actively
Mm.
do in our practice. So talk a little bit about that as well.
Yes, absolutely. So we'll be talking through some of the causes of gestational diabetes. We'll also be talking through some of the latest evidence in ways that we can improve the care that we offer to women with gestational diabetes. We're also going to talk about care after pregnancy. And this is often something that has been a bit neglected actually internationally. But of course, women with gestational diabetes are at high risk of other disorders in later life, such as
Mhm.
type 2 diabetes or cardiovascular disease. And I think we can be really improving the way that we communicate some of those risks from the end of pregnancy.
Wonderful, thanks. Yeah, a lot we can do there as well. Now, Claire, my last question for you, and it's a little bit different. So you're in research. If you had a, crystal ball, where would you love to see research go in the future? What would you love to see there?
Well, I think, from my point of view, one of the real challenges and one of the real joys actually of pregnancy research, but one of the challenges as well is that it's very multidisciplinary. It really requires buy-in from healthcare professionals from all walks of life. It requires primary care involvement, midwifery and obstetrics care involvement, also that longer term healthcare view. And in many systems, it's very hard to do that well. It's very hard to cross those disciplinary
Mm.
boundaries. And I think I would love to see a much more of an end-to-end approach in terms of women's health through the life course.
Oh, I love that. The end-to-end, through the life course, different
Mm.
disciplines working together, for women's health in general. Love that. Thank you so very much, Professor Claire Meek, for sitting down here with me, chatting about the amazing work you do with your team in research and education, and here educating us at Gold. Thank you so very much.
Thank you.
And for our viewers now, if you would like to find out more about the presentation here by Professor Claire Meek, Gestational Diabetes, Optimizing Pregnancy and Post-Pregnancy Care, as part of the Gold Midwifery Conference 2024, which gets started just around the corner here in February, please visit goldmidwifery.com. You'll find information about all the other presentations that we have. We have a fantastic lineup this year for you, and all the presentations will be recorded. So no matter where you are in the world, you can attend live online and, of course, have access to the recordings too. So I do hope we see everyone at the conference. Thank you, everyone, for watching. Have a lovely rest of your day wherever you are in the world. Bye-bye, everyone.
Thank you.